I'm Laura Siminoff, Dean of the Temple University College of Public Health, and joining me are our faculty experts, Graciela, Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy. Now there are two COVID-19 vaccines approved for emergency use. One is made by Pfizer, one is from Moderna. However, we're now being confronted by several new strains of the virus. So today we're going to be talking about that and what it means for the effectiveness of the vaccines that we currently have and the future trajectory of the pandemic. So I'd like to start with Graciela. So Graciela, can you explain the new variants of the virus and the implications of having a more transmissible virus in circulation?
Sure. Laura, there are now several new variants in at least 50 countries, including the United States. So how does a variant arise? The coronavirus is made up of a strand of RNA that is encapsulated and it's not alive. So it needs to attach and enter a human cell to multiply by using our cell machinery. Each time the virus multiplies, small errors may arise. So these errors are called mutations and happen all the time. The mutations that are beneficial or neutral for the survival of the virus will be maintained. Of course, mutations that are harmful to the virus are less likely to be passed on. A virus that has mutated is called a variant. So today, the most widely known variant is called B.1.1.7. When it arose in the United Kingdom last year, researchers noticed that the mutation happened in the spike protein. Spike proteins are used by the virus to attach themselves to a cell receptor and sleep inside our lung cells. Usually, the attachment between the coronavirus and our lung cells is loose and ill-fitting, so many viruses simply fall off. The mutation in the new B.1.1.7, however, the B.1.1.7 variant, however, allow a tighter fit and increase the chances of infection. So the more infectious the virus, the more people will get sick. With more people sick, we can expect that more people will be hospitalized, and sadly, more people will die. This is why we must look for and learn about new variants and follow them. In the meantime, how do we manage these new variants? Well, we continue to minimize the spread of the virus by getting vaccinated as soon as the vaccine is available and by taking the recommended precautions.
Thank you. I always learn something when you talk about the virus. So Heather, do you think the vaccines will work to create immunity against these variants, or do you feel that the vaccines will not work or be less effective?
Laura, it's a little too early to tell, and a lot of scientists are asking the same questions. But what we do know is that right now the mutations in the virus, although they're happening on the spike protein, the virus still requires that spike protein to enter our cells. And that's the way the vaccines have been designed. They've been designed to target that protein. So from that standpoint, people believe that it's likely that the vaccines will be effective. The other aspects about the Pfizer and Moderna vaccines is that they produce multiple antibody response, so not just a single antibody. So likely that the suite of antibodies generated in our bodies will help fight off, even if it's a new variant. What is more concerning is if the mutations of these variants continue and at some point alter the way that the virus infects our cells, and then those vaccines may not be as effective. I think I saw an article just this morning, though, that Moderna is working on a booster vaccine for these variants. So it'd be like a third shot that might also help boost immunity from the variants. But at this stage, it's kind of hard for me to say because I'm hopeful and optimistic, but we don't know what's going to happen down the line.
So Krys, now that we have vaccines, will we still have to continue to wear masks and social distance once we're immunized?
Yes, definitely is the short answer. So first off, I think it's important to note that people who are vaccinated with the currently approved vaccines, so Moderna and Pfizer, don't develop immunity until a few weeks after that second shot. So throughout the time that you're getting vaccinated and up around 3 weeks after that second shot, you need to make sure that you're at least as vigilant as you have been before, if not more so. but you should really maintain that vigilance because we don't know yet if fully vaccinated people can still become infected and then transmit that to other folks who are unvaccinated and may not be protected. So given that Dr. Fauci said that even the healthiest folks in the US are not going to be able to get the vaccine until mid to late summer, probably. So those are our young, healthy folks. Then we all need to continue wearing masks and social distancing to make sure that we're protecting everyone. Because as we know, even the healthiest among us have been unfortunately hospitalized and died as a result of COVID-19 infection. And continuing to wear a mask and social distancing also helps to reduce the overall number of infections, which reduces the likelihood of a new mutation happening, and also continues to protect you from variants until we can get a booster if necessary, like Heather suggested. So I will note that Dr. Fauci did come out in the last week and say that probably 2 masks are better than 1 at this point, since most people don't have access to an N95 or a KN95. So that would be a surgical mask covered by a cloth mask is what's suggested now because of the high infectious nature of the variants.
Right. And could you say just a little something about cloth masks and the type of cloth masks that are best?
Yeah, so there's been a lot of research on the type of cloth masks that are best. It's really those that have a tighter weave that are going to be best and that fit most closely to your face. And that can mean that you need to replace the ones that you may have bought at the beginning of the pandemic. And it's part of what fits most closely to your face. You probably want to make sure you have those that have a nose clip as well to keep your particles into yourself. So
And the number of ply, like 1 ply, 2 ply, 3 ply, I heard that you need really 3 ply.
Yes, you should. So Dr. Fauci's recommendation was to have a 3-ply disposable mask under a cloth mask. So then you're effectively creating a 4-ply altogether. And then the benefit of that is that some of our cloth masks fit a little bit better than the surgical masks seem to on people's faces. So it provides that tighter seal as well. So 3-ply plus 1 cloth mask for 4-ply.
Wow. It's been hard enough getting people to wear a single mask, let alone such.
I've been double masking for weeks, so I actually felt less paranoid when he said that.
Okay. So Sarah, given everything that's been said, it sounds like that the estimate that we need about 85% of the population to be vaccinated, this kind of explains why that might be. So how will we reach that goal, since so many people just seem like they don't want to be vaccinated? Even nurses are kind of, a lot of them rejecting the vaccine, and they seem to take kind of a wait and see approach.
Yeah. Well, the good news, I believe, is that now that the vaccine is here and people are starting to get it, the more people are thinking that they'll get it too. That's as, considering that there will be enough supply for everyone to do that. And the reason I say that is some of the newest surveys that have been done. So there was one by Pew Center that looked at vaccine hesitancy, and it is in fact dropping. So when they asked who would get it in August of last year, about 63% said they would definitely or probably would, and about 34% said they probably or definitely would not. But in December, those numbers have started to shift. So it's now 71% who are saying definitely or probably, and 27% saying no. So while we still have about, a little more than 1 in every 5 people saying that they don't want to get it, we are starting to move in the right direction. And I think, as I talked about last time we were together, the diffusion of innovation theory actually would predict that as more people in the general public get it, as it's starting to occur now, a significant number in that kind of probably not group will actually end up getting it, assuming the vaccine is easy to get. So, I think the question remains, what do we do to try and convince those who are still on the not side of wanting to get infected, getting vaccinated. So I think, one line of reasoning would be to not waste too much effort on them, because if we can get to that 80 or 85%, more of the public vaccinated, we'll have a sufficient herd immunity. The other line of reasoning would be to try and communicate with those people in a way that acknowledges a few things. So you definitely have to acknowledge their fears and reservations around vaccinations. Before Thanksgiving, I talked a little bit about what would you do if you had a relative who didn't believe in COVID or refused to wear a mask. And I would say the principles actually really remain the same on vaccination. So, it's things like don't oversimplify the issue and have to listen to their concerns, and just don't try and change their minds. So instead is, kind of focus on articulating why you plan on getting vaccinated, and frame it in that kind of personal context. Like, I have a mother who's going through chemo and it's important that I get to spend time with her right now. So that's why I'm getting vaccinated. Those types of stories tend to hold more weight for people. And, I think I would be remiss if I didn't end with talking about kind of the very real issues with vaccination for some people. There are a number of hesitant people who have very good reason to be. So, if you look at people with color, especially, who feel that they have first been totally ignored when this virus has so affected them, and then second, that they've been discriminated against in healthcare and research with unethical principles, practices that have kind of been a real part of our history. It's kind of understanding that they're more hesitant to do these things. And I think, we in public health really need to confront that head on and acknowledge it. And it's going to take a lot of listening and meeting these groups where they are before we can kind of really address some of these issues for them with vaccination.
Those are really all good points that we should bear in mind as we move forward in the enterprise of a really daunting enterprise of vaccinating everybody in the country. That's a lot of people. So anyway, I think that's it for today. Thanks for joining us. There is hope on the horizon with the vaccine. But even if you've been vaccinated, remember to keep wearing your mask and social distancing. Please view our other videos and find links to reliable sources of information at cph.temple.edu/coronavirus. Thanks for joining us.